Assalamu alaikum. I am Dr. Usman, and in today's video we will discuss about the complications of third molar. The complications, the problem we face in our clinical practice regarding the last tooth in our mouth, which is called the third molar. Means the tooth present in the last of our dentition is called the third molar or wisdom tooth. The problem we face regarding the problem we face regarding the wisdom tooth in our mouth. So first of all, we should know naturally there are 32 teeth are present in our mouth. 16 teeth are present on the right side of the arch and 16 teeth are present on the left side of the arch. And the mid line which is present between the central incisors means the front two teeth is called the midline. So midline differentiate the right side and the left side. So we have 16 teeth on the right side of the dentition and we have 16 teeth on the left side of our dentition, and both the arches have 16 tooth. So there are 32 teeth are present in our mouth. But in today's video, we will discuss about problem we face regarding our wisdom tooth after a certain age. So first of all, we will discuss about the eruption date of third molar or wisdom tooth. Eruption dates of wisdom tooth is around 17 to 25 years of age. Varies according to your geographical location, your genetics, and your diet. So we have different types of body types in our population. First of all, let's discuss about some people are shorter in height and some people are longer inside. Means some people have less space in their dentition to accommodate the last tooth. Means third molar, they have not enough space in their mouth to accommodate all 32 teeth. So their last molar, their wisdom tooth will be in a stuck position like this or like this in their mouth. We see these problem in X-ray when the patient comes to our clinic to extract the third molar or with the problem of wisdom tooth in their mouth. If we talk about geographical location, American African peoples have the larger space in their dentition as compared to the rest of the population, and the African people have the more accommodation in their mouth. So patients usually ask us why the treatment of wisdom tooth is so expensive and why we treat it surgically. So here we draw diagrams to make you understand properly and easily. So first of all, we will talk about the classification of the wisdom tooth problem we have in our clinical practice. If we talk about according to book, this classification is also called the Winter's classification of wisdom tooth or third molar extraction. In this classification, we take the second molar as the reference point and the bone of the jaw to the second reference point. So let's talk about the first case scenario which we can find in our clinical practice. So first third molar impaction is called the vertical impaction. Vertical means straight. Now let's appreciate this picture. In this picture, the third molar, the wisdom tooth, is in straight position, but it is coinciding the second molar and the bone of the jaw. Means its upper portion, its crown portion is half erupted, and it is coinciding with the second molar. So there are chances if this is when this tooth is about to erupt at the certain age at their eruption date, then they might coincide with the second molar on the bone, but it will stuck between the second molar and the bone of your jaw. So it might damage your second molar or the bone space in your mouth. So this is the second condition, the first case scenario which we can find in our clinical practice, or which we can find the problems related to wisdom tooth in our patients. If we talk about the statics, then this case scenario will be found 60 to 70% in our clinical practice, and this is the most common type of impaction regarding your third molar. Now let's discuss about the second case scenario. In second case scenario, the tooth is more angular and more towards the medial side, means more towards the midline, which we have just talked in the beginning of video. So this tooth is more tilted toward your midline and it is more angular in shape. Means it is not like a vertical position, it is like an angular shape. So that's why the second case scenario is called the mesioangular. Mesio means towards the midline and angular means it is angular in shape. Its angle is changed in this position. And so this is the second case scenario which we will find most commonly in our clinical practice regarding the wisdom tooth problem. If we talk about the statics, then this case scenario will be found 30 to 40% in the patients of wisdom tooth problem or wisdom tooth impaction in their mouth. Now let's talk about the third case scenario. The third case scenario is called the horizontal impaction. Now let's appreciate this picture. In this picture, you see the third molar, the wisdom tooth, and the last tooth the last tooth in your mouth is more tilted toward the midline. It is coinciding the root of the second molar. Means the second last mean it is coinciding with the roots of the second last tooth in your mouth and the lower arch. So it is called the horizontal impaction. Why we call it horizontal? Because this is not in angular position, it is not in vertical position, it is in more like horizontal position. It is like a more lying position. So this is the third case scenario, and it is the third most difficult which we found in our clinical practice regarding the patient of wisdom tooth problem or wisdom tooth infection. If we talk about the stats of this case scenario, then 20 to 30% of this 30 to 20 to 30% this case scenario found in the patients of the wisdom tooth infection. Now let's talk about the fourth and last scenario. In fourth and last case scenario, this is called the distoangular. Why we call it distal? Then why we call it distoangular? Because as we discussed previously in first case and second case, the fourth case the tooth is lying opposite direction, means towards the midline it's called median, away from the midline is called a distal. So this tooth is positioned in the distal position towards the opposite side of the midline. That's why it's called distal. And angular means it is angular in shape, it is not like a horizontal or vertical, it is in angular position. And its root is coinciding with the second last tooth, means second molar is coinciding with it with the roots position. So there are chances, if we try to treat that patient, if we try to extract this tooth, they might cause damage to the second molar in your mouth. This is the most difficult case scenario which we faced in our clinical practice. And if we talk about the stats of this case, it is found 10 to 20% in our clinical practice regarding the third molar infection patient. So these are the four case scenarios which we have most commonly found in our clinical practice. But you might found different position of third molar in their mouth beside all of these positions, because it is a natural process. We don't know how your tooth will be stuck in your mouth. So the infection could be of any type and any position, but these four positions are most commonly found in our mouth in our clinical practice regarding the patients of third molar problem or wisdom tooth problem in their mouth. About why we prefer to do surgical extraction in all of these cases regardless of first case. Now let's talk about why we prefer to do surgical extraction during all of these cases if we find in our clinical practice. First of all, because it is important to save the second molar during the extraction of the third molar or the bone of the under rest and the bone of your jaw, because if we try to manual extraction, then it might cause the damage to the second molar in your mouth and bone of your mouth. So we prefer to do surgical extraction in all of these cases. Now let's appreciate the last and fourth cases. In this position, if we try to extract this tooth in the manual try to extract this tooth manually, then we might damage the bones of your jaw or second molar of your mouth. So that's why we prefer to do surgical extraction in all of the wisdom tooth infection or wisdom tooth problem or third molar problem which we face in our clinical practice, so that we can save your second molar and your bone in your mouth and try to do minimal damage to your bone during the surgical extraction. So that we try to do minimal damage to your bone during the extraction. That's why we try to do surgical extraction in all of these cases. Let's talk about what's the American Dental Association recommendation of third molar regarding the extraction of third molar or third molar infection. They said if we found the problem if you encounter any problem regarding your wisdom tooth for the first time, then you need to extract all four sides of molar in your mouth, because there are chances you might face other side problem as well in future. But according to British people, they said if you encounter problem first time regarding your wisdom tooth, then you need to treat it or irrigate it, then left it alone. And if you found the problem again, means if you found problem second time regarding your wisdom tooth problem, then you need to extract only that tooth in your mouth, the advice of dentist. But according to my opinion, I recommend my patient to extract this wisdom tooth as soon as possible after firstly you will get any problem regarding your first molar impaction, regarding your third molar impaction or wisdom tooth impaction in your mouth. Now let's talk about another problem associated with the third molar impaction or your wisdom tooth problem. Now, if we that is called the pericoronitis. Now, what is pericoronitis? Pericoronitis is the inflammation of the gum tissue around the wisdom tooth or around the third molar. Now, let's look at the second case scenario. In second case scenario, if you found a tooth is placed in the distal position in your mouth in your bone. Now, if this position is in different shape, now, if this tooth is in different shape in regards to the rest of the tooth, then the gum around this tooth also in a irregular shape or irregular position. So you might hit your gums around the third molar or wisdom tooth when you're chewing, eating, or talking. When the eruption dates of your wisdom tooth comes, it might try to damage your gum tissue by your opposite tooth or by your talking, by your chewing the hard structure during your eating or during taking food. So this position will cause the inflamed gum, and inflamed gum slowly cause the pericoronitis. Means it will be persist for longer than the 30 days. So it will call the pericoronitis. So I recommend my patient to do surgical extraction as soon as possible. First time, as soon as possible after you get problem regarding your wisdom tooth. First time. So that's why I recommend my patient to extract your wisdom tooth as soon as possible after you get first time problem regarding your third molar or wisdom tooth in your mouth. For today's video, wisdom tooth problem or third molar impaction in our mouth and pericoronitis ends here. I hope this video will help you, and if you find this video helpful, then please hit the like button and subscribe to my channel. See you in next video. Till that, Allah Hafiz. Take care.